my name is Michelle Bronzo, and I'm a therapist specializing in grief, loss, and oncology. So I'm going to be speaking to you today about the topic of mental health for caregivers, which is such an important topic. So I really thank you so much for having me here to your conference to speak about this. I'm just going to move my bubble down here so that you can see the slides a little bit better as we advance through the talk. First Lady Rosalind Carter, who was an advocate for mental health needs, said the following quote. She said, "There are four kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver." We know that a cancer diagnosis is often a life-changing event, and that adjustment to cancer diagnosis includes a multitude of physical, cognitive, emotional, and spiritual changes for you, both you and your loved one as well, that you're caring for, right? And we know that these changes, both big and small, are often accompanied by feelings of grief and loss. I personally consider loss to be an inherent part of the cancer experience. And as research advances and there are more options for treatment, overall survival is improving, which is fantastic. Right? The goal for cancer is to be managed like a chronic illness. This is especially true for those living with an advanced cancer diagnosis, which then can mean that the time spent as a caregiver will likely increase and that the need for mental health support will certainly increase. Okay, so I'm going to briefly reflect on the many changes that can occur for you and the person that you're caring for after receiving a colorectal cancer diagnosis. This by no means is an exhaustive list. Many of these things may be familiar to you already, but just think it's important to acknowledge all of the things that make this experience really complicated. In terms of general changes, right, the first one, loss of life as I knew it, I'm sure is something that you all can relate to. Right? Life is so different, even just minutes after receiving a diagnosis, and you can't go back to how life was before as much as you might desperately want that, right? So a cancer diagnosis can challenge our belief system and change our belief system. We know that a cancer diagnosis challenges what we call the assumptive world theory. So our assumptive world is a strongly held set of assumptions about the world as being an orderly place, a fair place, a safe place. And traumatic events can shatter these core assumptions, right? A cancer diagnosis really can feel like it came out of nowhere. It's a complete and utter shock to people. So it can create a sense of mistrust about the world and one's safety in it, or mistrust in one's body, right? It feels like the body has betrayed you. And in terms of the safety of the world, there can be a fear of what could come next, right? I wasn't prepared for that, and I don't know what is coming down the pipeline. Right? Certainly a loss of control and anxiety, which we'll talk more about later in the presentation. Loss of relationships. You may have seen this already, where friends may not know how to support you or your loved one, and you may decide that some friends are just not capable of being there for you at this time. Additionally, you may find yourself getting attached to fellow cancer survivors, maybe in the alliance community or through other settings. And if some of those people die, it can be very challenging both to say goodbye to those relationships, but also because it triggers a lot of fear within yourself about your own situation. A cancer diagnosis can cause changes to work and finances to accommodate treatment or caregiving. Some of you may be struggling to stay employed and juggling your caregiving responsibilities at the same time, right? You may have already exhausted your FMLA, or you're in a position of having to make a decision about leaving the workplace. And if the diagnosed person is on your health insurance, there also may be an increased pressure to retain your employment. In terms of physical changes, right, these are the changes that you may observe with your loved one and have to support them around, as well as cope with yourself. Hair loss, not as common with colorectal cancer as other types of cancers, but it can still occur. Loss of a body part, there can be loss of bowel functioning due to an ostomy forming surgery. Cancer-related fatigue or insomnia is a huge one. We'll speak more about this in a couple of slides because it really does deserve its own slide. You may have witnessed weakness or stamina changes, peripheral neuropathy. It's hard to say. Peripheral neuropathy is one of the hallmark side effects of colorectal cancer treatment and more prominent in certain chemos. So we know that oxaliplatin, which is one of the core components of the drug cocktail called Folfox, it's the ox in the Folfox, is really it's well known for having this side effect. So peripheral neuropathy can include pain, tingling, extreme sensitivity, especially to cold or to heat, certain kind of textures, and a loss of feeling, which can make it difficult to walk or hold things in your hand. There can be taste changes, so even foods that the person may have previously really enjoyed may taste metallic or taste funny in some way. There can be skin changes, right? If someone's having radiation or certain kinds of targeted chemos, there can be rashes or burning to the skin. And then this is a list of side effects that I'm sure are very familiar to all of you. They've been very well documented in colorectal cancer treatment, things like pain, nausea and vomiting, diarrhea, constipation, right? These are the things that can be really, really difficult to manage and can impact the person's ability to be out and about, which can be difficult. Weight loss or gain, just general changes in body image. Sometimes weight loss or gain can be a positive change based on the person's goals, but that is something that can really happen for people. And then sexual health changes, I think, are not talked about enough at all, right? All the different ways that your sexual health may be impacted and your sexual functioning may be impacted. Surgical scars like a stoma or an ostomy bag can have a big impact on self-esteem as well as on intimacy, right? It just can really get in the way, especially as someone's getting used to their new ostomy. Erectile dysfunction, vaginal dryness, saliva changes, these all can be direct consequences of treatment. Numbness or changes in sensation, maybe what felt good before might not feel good anymore. And sometimes intercourse can be painful. And then infertility, right? Fertility preservation is not usually routinely broached by medical staff, although we've been seeing a change in this the last few years, which is really great. But sometimes treatment begins so quickly that the option to preserve fertility is lost. And so this can be a really painful, unanticipated side effect of treatment that someone may discover years down the line if they decide that they want to build a family at that time. I told you that we'd speak more about cognitive changes, cancer-related cognitive impairment, often referred to as brain fog or chemo brain. And cancer-related cognitive impairment is a really important clinical issue for patients and survivors. Up to 80% of patients complain of cognitive problems during treatment, and this can result from all forms of treatment. We know in particular there's a dose-response relationship between chemotherapy exposure and cognitive decline. So what I mean by that is that the more chemotherapy that the person has been exposed to, the more cognitive deficits that the person was likely to experience or report. And then there's a cumulative effect, right? The more treatment that you have kind of adds up, and it can be very difficult for people who will have to be on active treatment for the rest of their lives going forward, they may notice that the cognitive effects of treatment increase the longer that they're on treatment. From a study out of the University of Rochester Medical Center, they found that compared with the control population, that cancer survivors performed worse on a variety of measures, including verbal memory, processing speed, and executive functioning. This can be very frustrating for the person who's receiving treatment and very frustrating to you as a caregiver as well. In terms of emotional changes, I know some of that is cut off by my picture being there, but hopefully you can still see it. So in terms of emotional changes, body image, right, can be greatly impacted by things like surgical scars, weight changes, general appearance, which can impact sense of self. And we know that cancer can have a variety of mood changes and irritability, lability, which refers to sudden crying or anger, kind of sudden changes in one's emotional state. And you yourself may feel mixed feelings. We're going to talk about that later. And you may witness mixed feelings in the person that you're caring for. So in my work as an oncology therapist, I often see this most when someone is coming off of active treatment, right? That there can be a belief, I'm going to feel great now, right? I'm going to go back to life as I knew it. There can be an expectation both by the person and the people in their, the people who love them, right? That things are kind of going to get better from that point. And the person who's finishing treatment can often contend with really conflicted feelings like, shouldn't I be relieved now or excited, right? Shouldn't I want to throw a cancer party? I'm free from cancer, yay. And it seems that at that time, right, there's so many continued impacts of treatment and just stopping and processing all that the person has been through, that it's often a very emotionally difficult time for people, which can be confusing and unexpected. So some other emotional changes are a loss of interest in or withdrawing from activities, social events, and socializing. In some cases, there also can be feelings of hopelessness or worthlessness that develop, and even suicidal ideation. So it'd be really important to keep an eye on that for your loved one, because if they are exhibiting those kinds of feelings or saying things that are make you believe that there's some suicidal ideation, you would want them to get some support as soon as possible. In terms of spiritual changes, right, this component can be really big for people if spirituality is a big part of who you are, or your religiosity is an important part of the way that you live your life. A cancer diagnosis can bring about a loss of faith and spiritual distress, right? Why has God subjected me to this? Why is this happening? I've been a good person, right? All of these big questions and loss of faith in God and one's belief system. There's also existential distress, and what I mean by that is an awareness of one's own mortality and feelings of fragility. And this can also take the form of anticipatory grief. So anticipatory grief for additional changes or losses down the road that one might anticipate. So there can be a grief for the future, right? A grief for, what would it be like if I were to die? What would my family experience? What would I miss out on? So this can be a big part of the spiritual changes that someone goes through. Post-traumatic growth, it may be a term that's new for you. It may not be. It's getting more traction in the literature, which I think is fantastic. It's really the opposite of post-traumatic stress disorder. So post-traumatic growth, they've done a lot of studies on this, but it basically refers to the positive changes that someone makes in their life as a result of trauma. So we're not discounting all of the hard challenges when there is trauma, but they've also found that there's another side of the coin, right? So post-traumatic growth can show up in the following ways for people. There can be a renewed appreciation for life, a changed sense of priority. Sometimes people will change their job or make big changes in their life because they've had this experience that's so life-changing. There can be new possibilities or paths for one's life. The one I see so much is a greater sense of personal strength, right? So I have a backbone that I never knew that I had. And for those people that have been really important, have shown up, have been the people that you can count on, there can be strengthened relationships with those people. And lastly, spiritual development. Some people, as we were talking about before, feel that their spirituality or their religiosity is really challenged. Other people feel as though it's been strengthened. So let's turn our attention now to caregiving and some of the important characteristics of caregiving and the unique challenges that you all face being caregivers. So we know that each year approximately 44 million Americans serve in a caregiving capacity for a friend or a family member with a chronic illness, or for someone that can't perform the activities of daily living alone, right? So you're not alone in this, even sometimes it can feel as though you're so alone. There are 44 million other people going through the same thing. But as a caregiver, you're thrust into a role overnight that you get no training for, that you're not paid for. And, as a majority of caregivers are employed, adding what can be considered an additional full-time job on top of your primary employment can be very overwhelming. So some caregivers take temporary or permanent leaves from jobs in order to accommodate their caregiving responsibilities, which can lead to a loss of income. And caregiving can be limited or ongoing. So a study that was conducted by the National Alliance for Caregiving and an AARP found that caregivers spend an average of 4.3 years providing care. So you may be someone that has also provide more care than that, that you provide 10 years of care, right? So, but we know that people are spending a lot of time in caregiving roles. Caregiving can often be considered to be a thankless job and have a tendency to make people feel really burned out or exhausted and conflicted about the negative feelings that you might have towards your loved one. We're going to talk about that in the next slide. Some people also see caregiving as a very meaningful experience, and we'll talk about that as well. So mixed feelings in caregiving, right? I think that you all are going to relate to what we're about to talk about, and these feelings you may have had all the time, right? You may have had multiple of these feelings at once. And so understandably, it can be extremely confusing to have so many mixed feelings as you're in a position of caregiving for someone who you really love. Loneliness, right? So even when you have a supportive network of friends or family, caregiving can be a very isolating experience. While other people may occasionally see how hard it is for you to care for someone who's ill, for instance, they might see you helping your loved one walk. Those people likely won't be present for the challenging moments in the middle of the night or for the times that you feel most helpless, maybe when the side effects or pain are out of control. And those are the times that you would desperately want someone to be there to help you, but find that you're in this by yourself to try to deal with the situation. And, many people ask how the person you're caring for is doing without thinking about asking you how you're doing. So this can really exacerbate how alone you might feel and just unseen you might feel being a caregiver. Anticipatory grief refers to when you're caring for someone with a protracted, serious illness. There's often a background awareness or wondering about if and when the person will die. even when your loved one might be doing relatively well, but it's kind of always hanging there in the background, right? And so it can really be a balancing act of both being with the person in the present, spending time with them, but also grieving for what life might look like, if the person were no longer alive. And anticipatory grief can take the form of intense sadness, right? You may feel yourself wanting to pull back from the person that you're caring for in an effort to protect yourself. Guilt, right? Guilt can manifest in a number of different ways. So some really common situations that elicit feelings of guilt are, let's say, leaving the person you're caring for to have a break or to do something for yourself, wishing for the person to die, or feeling relieved when the person does die, and perhaps believing that there was something that you could have done or should have done to prevent the person's illness or the person's decline. And it's really, really normal for a part of you to wish that your loved one would die, right? There's times that you wish that both you and that person, that they didn't have to struggle anymore. And it can be really hard to offer yourself grace and compassion in moments when you have to make really hard decisions, right? Sometimes you're deciding between two really crappy options, and these can be guilt-inducing. Ambivalence is a word that describes both loving the person fiercely and also having strong negative feelings about them as well. So, for instance, how is it that I might wish for the person to die at the same time as wanting to be with them desperately, right? That talks about ambivalence. And we know that all relationships contain ambivalence. No relationship is either all good or all bad, right? There usually are times of closeness and deep love, and also times when the relationship is challenged, and they represent strong feelings, right? So these strong feelings show us how much the person means to us, both positively and negatively. And sometimes people think, well, isn't the opposite of love hate, right? So how can I both love and feel hatred, or whatever the feeling is towards the strong negative feeling is towards the person at the same time, right? The opposite of love is not hate. The opposite of love is considered to be indifference, right? Or not caring, rather than hate or resentment, or again, whatever the strong negative feeling is. But that being said, ambivalence can be a really confusing thing to experience, and that may be something that you've experienced before. Resentment, anger, and jealousy, right? Why me? I wish that I didn't have to. That person has it so much easier than me, right? You may find yourself feeling really jealous of friends who feel carefree, or even jealous of yourself, your own pre-caregiving life, right? Pre-cancer life. And we know that caregiving has a tendency of interrupting life plans and hitting pause on the path forward, right? So you may have just entered your retirement years, and we're looking forward to spending that time with rest or enjoyment, or maybe travel. You may be a young adult having to care for a parent and moving back home, or stepping away from a career, not being able to have any romantic relationships, or interrupting romantic relationships. Or you may be a parent of your own children, having to give care both to the loved one and to meet the needs of your children. And so, while that the person who's ill is not to blame, it can be really hard to not feel angry towards the person for all that's changed in your life and will continue to change going forward, because it's really thrown a wrench into your life. Anxiety stems from a variety of different places, right? So as a caregiver, you're sometimes asked to do things that you would really expect a medical provider to oversee, right? Medication management, dispensing the medication, assisting with a medical device, providing hands-on care. And I've had a lot of people say to me, what was I supposed to do again? How much was I supposed to give? How do I flush this tube, right? There can be intense fear about making a mistake and doing harm to your loved one inadvertently, and that can create a lot of anxiety. Additionally, an ongoing medical situation can make even the most relaxed person feel out of control, but particularly for someone like me who thrives off predictability and order, right, that this can be extremely stressful. There can be a lot of anxiety about medical procedures. If you haven't heard this term already, it's a great one. It's called scan-anxiety. It's the anxiety around upcoming scans, right? What will that show? Will it show that the treatment is working? Will it show disease progression? And ultimately, fear of the unknown. What's going to happen, right? That generates a ton of anxiety. Horror, disgust, and embarrassment, I think, are the aspects that are discussed least, right? And are probably the things that you would not feel comfortable sharing with the people in your life, right? There are just some parts of being a caregiver that are gross and icky, and especially if you have a weak stomach or are prone to feeling squeamish, right? So you may have to clean up blood or vomit or feces, urine, right? Other bodily liquids, and you may feel embarrassed for the person or even for yourself. You also may witness an event that is traumatic in nature and hard to get out of your mind. So, and I'll share with you that when my dad was ill, he had been sitting in a chair for quite some time. He was resting there, and he got up from his chair too quickly, and he fainted and fell into a glass cabinet. And so, of course, cabinet shatters, and he gets a really long cut on the top of his head. And so, of course, we hear the loud crash go running downstairs, and there's just blood everywhere, right? It wasn't the deepest cut. I mean, he had to get stitches, staples maybe, but because it was on the head where there are a lot of blood vessels, there was a ton of blood. It looked like a crime scene, right? And he ended up being fine, right? But at the time, it felt like it could be, that it was so serious. It was an emergency, and we were so afraid that meant that he was going to die, right? And those kinds of events can be extremely traumatic. It can be so upsetting, right, to see someone you love go through these experiences. Makes them seem fragile, vulnerable, childlike. But caregivers often remark that they rise to the occasion somehow. They do things that they didn't think that they were capable of doing. In spite of all the big feelings that I just mentioned, caregivers will often say that they would do it all over again, or that they wouldn't trade that time for the world. So why is that when there are so many hard things to navigate? We know that caregiving for someone can create a closeness, a kind of intimacy that is like no other, right? You're seeing the most raw, real parts of the other person, kind of the person stripped down. They trust you so much that they're willing to have you there with them in the moments that no one else gets to see. So for some people, that can feel really special to have that kind of honest, raw trust. If you're caregiving for a parent or a caregiver, there can be a feeling of giving back after years of them caring for you, maybe when you were a child. And there can be strong feelings of love, gratitude, and fulfillment. So that got cut off there, but you can see that it says caregiver. We know that you cannot pour from an empty cup. It's so hard to remind yourself of your own needs when you're so consumed by the person that you're caring for, the needs of the person that you're caring for. So I'm just going to ask us to take 1 minute and sit quietly and reflect on the following question. And I'm going to ask you to think about this. You can jot it down, you can pop it in the chat, or you can just sit in quiet reflection. How have you found time for yourself as a caregiver? And what strategies for self-care have made the biggest difference? So how have you found time and what has worked? Okay, so we're going to give it a minute now. Okay, thanks for taking the time to do that. I encourage you to keep that in mind as we go through some of these strategies for coping. We're going to talk both generally and specifically, and I think it's always great when you can let others know what's worked for you. It may not work for that person, but to sort of generate all kinds of possibilities as a group will be really helpful for all of you to figure out what works best for you. So just generally, self-care is really different than being selfish, right? I hear people using the word selfish often when they're talking about self-care, right? And the word selfish has a very negative connotation. So being selfish is something that, selfish is a word that refers to the things that you do for yourself for your sole benefit. Whereas self-care refers to the things that you do for yourself that in turn serve others. So self-care refers to things that you do that allow you to be a better version of yourself for the person that you're caring for, that allow you to show up more, and ultimately self-care is in service of your loved one. Another problem is that people can think that self-care will take a lot of time. So self-care is really is our strategies for coping that range from just a few seconds to a full respite, like a vacation. So there's always time for self-care, even though people may sort of falsely believe that they don't have the time. One of the ways that you can make sure that you're building in more time is to be deliberate about scheduling self-care time on your calendar. Putting in 15 minutes every day. That comes up on your calendar. You're going to be reminded of on your phone that you're committing to, because it's very easy for a million other things to take the place of that, and then you lose out on that important self-care time for yourself, right? So let's talk about some specific ideas for self-care. So again, you may not have time for the big things like a massage, right? The things that people typically think of when they're thinking about self-care. But you always have time to do the small things. And if there's one thing that I want you to walk away from this talk with, it's this. Small things add up to a sense of replenishment. So if you do a couple of small self-care things throughout the day, maybe 30 seconds here, a minute here, 5 minutes here, right? It's really going to be meaningful. I encourage you all after the talk to take some time to develop something called a self-care menu. You can keep it on sort of as a note on your phone to remind you of all the things that help you feel calm and replenished, so that you don't have to reinvent the wheel when you're feeling depleted. So the self-care menu is organized by the 5 senses. I'm going to share with you my self-care menu for myself, just so that you have an idea of how to do this, how to develop this. So it's organized by the five senses. So for sight, for instance, these are the things that you would see or look at that makes you feel calm or that makes you feel joy. For me, it's either being there physically or looking at pictures of water sources, right? An ocean, a river, lake. To me, that's very replenishing. I love to watch fire, so like a fireplace or candles, nature scenes like a forest or mountains, and then pictures of puppies and kitties or videos of them doing silly things. Really, just for a moment, just gives me a little bit of a break. In terms of smell, the things that I smell that give me a break or that make me feel replenished. I have an intense sweet tooth. Everybody knows this about me. So if there are cookies or baked treats in the air, that's something that's going to give me a lot of pleasure. I love the smell of candles. Fall smells like, we have all these right now, which is great. It's my favorite time of year. Spices, ginger, cinnamon, chai, the smell of firewood in other people's homes. Those are the things that just make me, oh, that's so nice, right? That's just a moment that is so nice. I love that smell. In terms of taste, the sort of tastes that make me feel joyful or replenished, chocolate, having just a square of chocolate, having hot tea, chai, ginger, sometimes cold water for me. It's such a shock to the system if it's really cold water. And similarly, tart grapefruit juice are things that for me, from a taste perspective, really help me just have a break from what it is that I'm doing. The things that I can touch that I know give me a break, things like petting my cat, hugs from my partner. I love cozy, snuggly blankets, cuddling stuffed animals. Yes, I'm aware that I'm an adult that sleeps with 3 stuffed animals, but they bring me a lot of joy and hot showers, right? And that feels like a really nice, relaxing break. Sound refers to the things that you would hear that that allow you just to have a moment of reprieve. For me, I am a big Broadway music fan. I love musicals. So hearing my Broadway music playlist, listening to relaxing music, like kind of spa noises or relaxing noises. I know that if I call my friends or family, that their voices really take me out of whatever the situation is that I'm in. And then things like, waves crashing or nature sounds. So that is just an idea of some things that you can do for your own self-care menu. I hope that you will spend some time afterwards thinking about that and what might work for you. Let's talk about some more specific strategies for coping. So just as you're caring for your mind, right, you're caring for your body as well, right? That going back to that quote of you can't give from an empty cup. You're not going to be in service of your loved one if your body is running on empty or you become ill. So certainly making sure you're prioritizing time for exercise, fueling your body with nutritious food, which I know can be difficult when you may have limited time to cook and food shop, but to the best of your ability to do that, that's going to make you feel better and ultimately healthier and stronger to be able to be with your loved one. If you haven't tried this already, I encourage you to try something like mindfulness or meditation. Some people find that just open-ended meditation is too difficult, especially when you're beginning out. So something like a guided imagery, you can script, you can find that on apps like Calm or Headspace or even on YouTube. You can just type in, guided imagery, ocean, and you'll get some really lovely guided meditations that have instructions and words that help you just get into a calm space. And these can range from, 5 minutes long to 20 minutes long, an hour, you pick whatever you have time to do. acupuncture can be a wonderful way to have a break for yourself, and also to align your body. And then expressive arts outlets like journaling. If you haven't tried an adult coloring book, they're really wonderful. Having to color in so specifically in the little lines can be calming and enjoyable to have a finished product that, you know, that's really detailed, that you feel proud of. Listening to music. I think the number one thing, as you were saying before, that people think about when they sort of the ultimate experience for coping as a caregiver would be to be able to have a respite. So, you know, if you're in a position to ask a trusted family member or a friend to relieve you for a couple hours or even a day or a couple days so that you can have a break. You know, this is a marathon, not a sprint, and you need to have vacations from caregiving just as you would need to take a vacation from work, right? So this may not always be possible, but if you're in a position to take some respite time, I encourage you to think about how that, you might make that possible. And then, join a caregiver support group, right? You can Google caregiver support groups near me to find a caregiver support group, or join a caregiver support group through the Alliance. A great way to feel as though you're not alone in this experience, right? Like all of the other people taking part in this talk today, right? There's so much wealth of knowledge out there in terms of what people have been through, as well as what's worked for people, or just to commiserate. It's so important to have a group of people that just really get it. You may not have that in your group of friends because they may not have had the experience of being a caregiver. And then lastly, to seek out individual support with a therapist if you feel it might be helpful to have someone help guide you through this experience. And just, I want you to walk away from this remembering that you're taking on so much as a caregiver, right? I know that that's not often visible to other people. I see you, the people at the Alliance will see you, other caregivers will see you. So I encourage you to continue to reach out for help at this time that we know is so difficult, right? And I've just popped my contact information up here for you all to have. I think that got cut off at the bottom, but that just says "com" at the last bit of my website. I encourage you to use the rest of the time that we have. We have a couple minutes left for Q&A, or if you just want to chat in, chat in the chat box. That's a great way to connect with others. But I'm here for questions if you would like to use the rest of the time to do that. But if you also wanted to ask me a question privately or connect with me offline, my email is michellebronzocounseling@gmail.com. And again, I just want to thank you all for participating in this talk today. I hope that you are walking away from this talk with maybe something new that you hadn't thought about before, or just to feel connected in this group of people that understand what it is that you're going through and the difficulties that you face day in and day out being a caregiver. Thank you so much. Hello, everyone. Thank you so much for attending this presentation. I know that there was some issues with the audio syncing up with the slides, so I hope that wasn't too distracting for you. I would love to answer any questions that might come through. I'm not sure I see those questions at the moment, but there we are. Okay. So the first question is, as a patient, how can we feel supported? As a patient, how can we feel supported and still try to give support to our caregiver when able? So I think, if you are a patient attending this talk, how you might be able to support your caregiver while also caring for yourself would be
to give explicit permission to your loved one, to the person caring for you, to take breaks, and then to follow through and really insist that person is taking a break, right? Check in on them to see what they've done and hold them accountable, because that's really going to free them up to take the much needed breaks that they need. I think secondly, you could encourage friends and family who are calling to check in on you to see how you're doing, to also call and check in on your family caregiver. Because as we were saying before, family caregivers can feel so unseen. People will ask, oh, how is the person who's going through treatment doing, and not ask the caregiver how they themselves are doing. So if you can encourage your friends and family to call and check in, that would be really helpful. I think also as a family, you could plan some what I call cancer vacation time. And what that means is time that you enact either throughout the day or the course of a week that is cancer-free time. So talking about cancer is not allowed. It gives space, time and space to talk about other important things in your life, because you as a patient, you are not cancer in your entirety. There's a lot of other things that make you who you are as a person, and same goes for your loved one who's caregiving. And so having the space to not talk about cancer can be really helpful. Okay. Another question is, let's see. During treatment, so much focus is on the patient. What programs are available for our caregivers? So I spoke a little bit about that in the talk. I know that the Colorectal Cancer Alliance has some great resources on their website for caregivers, really wonderful practical solutions. There's the Alliance Buddy program. The Colorectal Cancer Alliance helpline is manned all the time, and you can speak with a family, patient and family support navigator through that number. So definitely do take advantage of that. You also might want to check with your county, their Department of Aging and Disabilities, or other similar departments, to see if they might offer any caregiver support services to you through the county. They offer a variety of different things. Excuse me. And then also, if you're caring for someone who's a veteran, the VA offers a program called the Program of Comprehensive Assistance for Family Caregivers. And any eligible family caregiver can receive things like caregiver education and training, and mental health counseling. They even often offer some financial assistance for travel, for lodging, if you are traveling with a veteran to receive care. The next question is, I get very overwhelmed, and then I get upset from being exhausted, overwhelmed, and unsupported. How can I break the cycle of exhaustion and getting upset? That's really difficult. I know that it can be hard to break out of that, especially if you've been doing this for a long time. And I go back to just this conversation about self-care and respite, because when you feel like your whole life is in service of the other person, it's easy to be resentful of that and of that role, and not having enough time to replenish yourself, so that then when you go back into that role, that you have the resources that you need internally. So definitely make sure you're taking time to do that. I don't see any other Q&As popping up right now, so I encourage you to send some in. But I also was just before this, was working with someone who is a family caregiver, and we just were having a conversation, which I think would be important for me to just touch on briefly. You may have had a situation where you've heard your loved one say things like, I wish I would just die, or I don't know how much longer I can go on like this. And these kinds of statements can be really hard for family caregivers to hear. And so I just want to talk a little bit about this, because I think this is really important. So first of all, rather than brushing off these comments, it's really, really important to acknowledge them and validate them, even if you don't agree, right? You might have really strong feelings when you hear someone say that. but to really make sure that you hear it and not brushing it off. And you'd want to assess for suicidal ideation, right? Is the person just saying it because they're feeling like it's a difficult moment, a difficult day, or are they actually thinking about ending his or her life? So again, the distinction is, is the person in distress physically, emotionally, spiritually, but it's temporary, or is the person really thinking about ending his or her own life? And if so I'm going to tell you a little bit about how to do that assessment. So you really want to determine, is this an abstract thought, or is this something that they'd want to do soon? Does the person have a specific plan? Do they have access to the means that they would use to enact their plan? And, contrary to what you might think, asking someone about suicide and if they have a plan doesn't give them the idea. I hear that a lot from people. If people are thinking about dying by suicide, they are thinking about it all the time. You're not giving them the idea by giving voice to it. And in fact, it often stops many people from dying by suicide because they are able to get the help that they need. So, if you're in this position, you may want to do this assessment by coming from a place of curiosity. So it could look something like this. I know a lot of people have thoughts about ending their own lives. Is that something that you think about a lot? See what they say. Or, people think about different ways in which they might die. Have you ever thought about what you would do if you were to end your life? Might you jump somewhere? Might you take pills? What might you do? And so let's say the person says that they would take pills, then you might follow that up with, I wonder, do you have access to pills like that at home? So you're really just being curious and getting information about how serious they are about thoughts like this. So if you get the sense that the plan is developed, that there's access to the means that they plan to use in order to end their lives, and they have an intent to die soon, you would immediately want to take the person to an ER or an urgent psychiatric assessment center that does, again, urgent walk-in appointments. And then if you sense that the thoughts are more just coming from a place of distress, it's more passive suicidal ideation, that would be a great time to refer them to a psychiatrist or therapist to help process those thoughts and feelings. And, and the same goes for you as caregivers. If you're having these thoughts, be sure to tell a professional mental health care provider about that. Not sure I see any other questions here. Okay. Now, we have a couple more minutes left, so just, some other things on my mind that might be helpful. If you're thinking about respite, right, can anyone else help you care for this person? Are there friends? Are there family members, neighbors, maybe someone from a religious community, a member of a religious community, or members of an organization that you might just expand your social network so that, you can get some more time for yourself. And then sometimes people ask me about the benefits or resources that your loved one as a patient might be entitled to. That could be from their job or from nonprofit organizations that can help financially or with transportation, with cleaning services. You may want to ask the hospital system or care practice that your loved one is receiving medical care through to see if there's a social worker or a case manager there to help determine what your loved one is eligible for and to help you apply. And I'll just leave this open. If any more questions come in, I'm not sure if the slide with my contact information made it up before we transitioned over to the Q&A, so I'll just repeat my contact information again. I'll put it in the chat. I hope that will go through, but it's Michelle Bronzo Counseling at gmail.com. you can feel free to send me a message there if you want to, if you have a question that you wanted to ask offline, or you want to continue the conversation. And my website is www.michellebronzocounseling.com. Okay. And so, okay.